Hello, my name is Melody White, and the organization I will be presenting is called Health Leads. So who is Health Leads? It's a non-governmental, nonprofit organization that has been around for over 20 years. It was founded in Boston, Massachusetts by Rebecca Oney in 1996, and it started off as being called Project Health, where the organization helped patients with food and housing assistance. It became a nonprofit in 2001, and it rebranded as Health Leads in 2010. So now we'll talk about their focus and mission. Their mission, in their words, is health, dignity, and well-being for every person in every community. Also, to change healthcare throughout the country to allow those within the community to become more involved, because they want to break the barrier between those within a community and healthcare so everyone can obtain the resources they need to be healthy, no matter their background. Now, their focus are inequalities in healthcare that stem from racism, inequalities in healthcare that stem from income, and community-led based initiatives. To be able to do these community-led based initiatives, they bring members of those communities to participate in ways to improve healthcare and have those members provide input on their healthcare and what they need in their communities. So what drives them? What drives them are the many statistics surrounding health issues. For example, the image on the right is a visual representation of what factors impact health the most, and the number one factor is environmental and behavioral factors, coming in at 60%. They also mentioned that even though the United States spends the most on healthcare out of every other country, because the need is so saturated, not many people in need get the help they deserve. They want to bring in the communities in need and allow them to have the input on healthcare decisions to lower the inequalities faced throughout the United States and work within other organizations to provide the much needed resources within these communities. So what do they do for the community? Number one, they connect those with different communities to health resources. Number two, they fix and reshape healthcare system, which ties in with number three, to allow those within a community to have input on their living conditions. And lastly, number four, they help push the objective of racial health equity. So what are the minority groups they support? One is people of color, and they focus on how ethnic or racial minorities suffer from health inequalities due to racism. Example, COVID-19. As many people witnessed with COVID-19, people of color are more susceptible to the virus, and the CDC labeled racism as a fundamental driver of racial and ethnic health disparities. Health Leads agrees with this and is working on undoing the deep-rooted racism that impacts health. They also support people living in poverty and low income by focusing on how environmental and income factors affect healthcare throughout the community. They have people from low-income communities become educated and provide them with resources to become a voice in their communities for healthcare. So what has been their impact? Well, for starters, they have a greater community input on health issues that affect them. This is their community-led approach. Second, they created an advocate bootcamp to train volunteers. This creates advocates for understanding social need and how it affects healthcare. They also invented the screening toolkit, which helps healthcare systems to screen patients for social need initiatives that affect their health. Number four, they have social need workshops, which teach healthcare workers the importance of knowing social needs and its correlation to health of patients. Number five, they have patient advisory councils, which is when patients and caregivers come together to discuss ways to improve healthcare. And they have a searchable library with community resources. And these are only a few of their impacts on the community throughout their 24 years.